Hello everyone, Dr. Ernesto Medina here, founder of True Integrative Health and Functional Nutrition, just outside the Austin, Texas area. Welcome to my case study. So this case study I'm presenting to you today is very near and dear to me. It's very special to me because it is a case study of my wife. And my wife is a very private person. She doesn't like to share her struggles. But given the experience she had navigating the conventional medical system with this recent health challenge she had and she's been struggling with for the last 3 to 4 months, she felt it was her duty and her responsibility to share her story for others who are suffering or who may be suffering with similar symptoms just like her. And so I thank her for allowing me the opportunity to present this to you all. And you get this unique perspective of us being patients, but me also being one of her primary healthcare providers as she dealt with this debilitating health struggle. So here we go. Quick disclaimer, right? This information is not intended to treat or diagnose any conditions. It's really just for informational purposes. But what you're probably going to learn as we go through this, is that if you've been struggling for years with symptoms similar to these and conventional medicine hasn't had anything to offer you and you're still suffering, maybe it's time to look outside the box. So this is my wife, my beautiful wife. She very happy, very active person. We are both very active together. We love to travel. We love to exercise. We love to work out. We love to CrossFit together. We work out probably anywhere from 3 to 5 days a week, depending on how busy our week is. We eat a very healthy diet, mostly a paleo-based diet with minimal grains, no processed carbohydrates, really. Minimal rice, and mostly just meat and vegetables. And so we live a healthier than average lifestyle, healthier than the average American. And she went from being active, happy, and healthy to practically disabled. And we'll talk about what her symptoms, her disabling symptoms were. But you can see here, this is us doing some rehabilitation on her in the early stages of her sickness. And you can see how miserable her face is here, just because the symptoms were so disabling for her. So the signs and symptoms she was experiencing when this first started, and this really started probably back in end of September, beginning of October, where she started to experience a cluster of different symptoms. But before that happened, what she was experiencing, so we are new to the Austin area. We've been here almost a year, and she had trouble adapting to the heat and humidity, especially during the summertime. And so we would have to run the air conditioner. And we came from California, right, where the weather is a little more reasonable. And we had to run the air conditioner all through the night. She has issues breathing through her nose because of a broken nose she had as a child that never healed properly. And so she breathes through her mouth pretty often because her nose is always congested. And that in combination with running the air conditioner all night would cause her throat to really dry out, and she would wake up with a really bad cough. Well, this continued to happen repeatedly through the spring and the summertime to where she would have to go see her primary care to have her lungs checked. And the first time she got prescribed antibiotics, took care of the cough, great, she was fine. A couple weeks later, it happened all over again. She got a steroid shot, took care of the problem, great, that's fine. But this process kept occurring over and over again, and we knew it was because she just couldn't breathe through her nose at night. And so luckily she discovered this routine that she now does that eliminated the problem, but it's a routine of nasal spray to clear her sinuses in combination with a breathe right nose strip that she puts over the nose, in combination with a botanical throat spray that she sprays to the back of her throat before bedtime each night to keep her throat from drying out and to keep bacteria from overgrowing in there from all the dryness. And this routine she has now has eliminated the problem, luckily. However, I believe that this series of lung issues in combination with all the serious coughing led to her debilitating symptoms, and we'll talk a little bit more about that towards the end. However, about a month prior to her becoming really disabled, she did get sick with some sort of infection. We don't know what it was. It wasn't COVID, because she got it from her niece, her 1-year-old niece, who never tested positive for COVID, and neither did my wife. But it was just some sort of bad virus that took her out for about 2 weeks. But after her system cleared that infection, what remained was some pretty debilitating, lingering fatigue. And again, we were very active, liked to exercise every day. And so going from that to really disabling fatigue, was worrying. That's when we discovered she was dealing with some low blood pressure issues. And this got brought to my attention in one of her doctor visits for her lungs. She was told that her blood pressure was a little lower than normal. And I'll expand a little bit more on that in a second. But the low blood pressure in combination with some dizziness that she started to experience with position change, which this term is called orthostatic intolerance, meaning she wasn't tolerating changes in upright position. And that dizziness was quickly accompanied with shortness of breath and tachycardia. Tachycardia being a drastic spike in heart rate. And she started to experience this cluster of symptoms. And that's when I really sat down to examine her to find out, well, what really is going on? What other systems are affected that maybe she's not aware of that are contributing to her symptoms? And I discovered that she was also having pretty bad loss of balance and spatial awareness, specifically with her eyes closed. And so when she would walk around the house, obviously with her eyes open, no issues, she wasn't falling over or anything. But if I would have her stand and close her eyes, her brain had lost total sense of her surroundings, of her awareness, of her spatial awareness. And as soon as she would close her eyes, she would fall over, which is never a good sign. And this is a picture essentially of her blood pressure we were monitoring, 92/57 with a resting heart rate of 66. Now, for medical standards, this is still considered normal. Anything below 90 for the top number and anything below 50 for the bottom number is then considered low blood pressure. So this is considered low normal. However, we already knew that her resting heart rate, I knew her resting blood pressure was about 110, 115 over 70. And so for her, a resting blood pressure of 92/57 was definitely very low. So this was something that was definitely on my radar. Now, given her cluster of symptoms she was experiencing and the tachycardia, she was presenting with symptoms very similar to what's called POTS, which stands for positional orthostatic tachycardia syndrome. Now, according to the Cleveland Clinic, their definition of POTS is a condition that affects circulation. It involves the autonomic nervous system and sympathetic nervous system. Sympathetic nervous system meaning your fight or flight response. POTS is a form of orthostatic intolerance. The development of symptoms that come on when standing up from a reclining position. It can also happen to a lesser degree from sitting to standing, and that may be relieved by sitting or lying back down. And the reason these symptoms develop is usually because the brain, for whatever reason, the brain isn't properly regulating blood pressure appropriately. And when we get up too fast from a lying position, our blood pressure does not compensate for our change in position, right? Because when we're lying, it's easy for the heart to pump blood throughout our body. As we stand up, we work against gravity, and there has to be some sort of adjustment from the brain signaling to your autonomic nervous system to change its regulation of blood pressure to make sure you continue to get blood and oxygen to your brain. People who have very severe POTS will often feel like when they stand up from a sitting or lying down position that they're going to black out, or they do pass out. Or I've had patients in the past that say that their vision just goes black for 2 to 3 seconds and then it comes back, right? This is that orthostatic intolerance where their blood pressure is just not regulating appropriately and they're not getting blood and oxygen to the brain, and those are the consequences. And so if we break down POTS is a specific diagnosis. And the only way to really diagnose POTS, the gold standard of diagnosing POTS, is through a cardiologist, where they do what's called a tilt table test. And realistically, I knew it was going to be very difficult for us to find a cardiologist, first of all, because this was just before the holidays, and it was going to be difficult to get approved for a tilt table test through our insurance. So, but if we break down POTS, right? POTS is a generic term of intolerance to position change. This is that orthostatic intolerance. But it's also a dysautonomia, which refers to a dysfunction of our autonomic nervous system and its ability to regulate either heart rate or blood pressure or tone of blood vessels that helps regulate blood pressure, right? And so there are many people who suffer with POTS-like symptoms but don't fit the criteria perfectly for POTS, which, by the way, on a tilt table test, the criteria is when you go from laying down to an upright position, you have to have an increase of 30 beats per minute of your heart rate or more. So 30 beats or more for adults and 40 beats or more for kids. And so many people will experience all these cluster of symptoms very similar to POTS. However, if your heart rate never goes to 30 or above, then you don't fit the criteria and you're not diagnosed as POTS. And so many of those people will be left, with no help or no guidance, no strategy to try to improve their situation. So I wasn't too worried about having a tilt table test. I knew that there was a dysfunction in her autonomic nervous system in regulating blood pressure, and I knew that there was some sort of orthostatic intolerance issue going on. And so what we know from a neurology perspective is balance and spatial awareness is controlled by a couple different systems of the body. The first one being the vestibular system, the second one being proprioception, which refers to sensory feedback from muscles and joints, and specifically joint capsules that send feedback to the brain of where our limbs are in space, right? This allows us to be able to close our eyes and know where our nose is or where our ear is, or touch a toy car and be able to identify without looking at it that it's a toy car, right? These are all these sensory feedback systems that we have. And we also use our visual system, right? Visually being able to see our surroundings allows us to orient ourselves in space. And so we can have breakdown or dysfunction in any of these systems, and it can influence and affect negatively balance and spatial awareness. And so what I did is I went through and I started testing each of these things on her. And we also know that the brain is broken up into specific areas, regions that have specific functions. Specifically, what we were looking at is right here, her parietal lobe, number 9, and even number 10 here, which is referred to as the sensory cortex. And the sensory cortex, you can see right over here, sensation from muscles and skin, right? And so one of the things that we want to evaluate when worried about orthostatic intolerance is, does our brain perceive where our body is in space? When we go from a laying down to a standing position, is our brain aware of that change in our position, right? And our body's relationship to our environment. And so we went through and we tested each of these things on her, and they're done through a pretty comprehensive examination, right? It's not anything difficult or fancy, but it is time consuming, and it's done in the office. And then we went through her vestibular system, which refers to this system of the inner ear, which is a combination of the semicircular canals, which you can see pictured here, and her vestibular nerve here. Now, these canals in the inner ear basically have fluid in them, and when our head moves and our body moves, that fluid in those canals move, and when it moves, it sends signals through the vestibular and cochlear nerve to our brain to let the brain know that we are moving, right? We are changing position, or we have tripped and we're falling and we need to protect ourselves. And so we needed to evaluate deeper into this system to see how this was influencing her balance and her spatial awareness. And this is a big system that definitely always needs to be evaluated when working with or dealing with orthostatic intolerance and dysautonomia. And so as I went through testing this, right, we can try to isolate each of these systems by trying to eliminate one and testing the others. And so, like I mentioned before, when I would have her, when my wife would walk around in the house, no problems, right? She wasn't falling over, she wasn't tripping over herself. But when I would have her stand and close her eyes, we eliminate that visual system, and the brain now depends on the vestibular system and the proprioceptive system to increase our awareness and to be aware of where we are in space, right? So if we start to tip and fall over, that change in pressure of our feet onto our toes or onto our heels should ideally tell our brain, uh-oh, we're starting to rock backwards. Oh, here we go, we're falling. And her systems were not working well at all. And I discovered that it was largely her vestibular system that was having a major deficit. The vestibular system is the biggest input into our balance and spatial awareness. And so I was able to find out that she was having quite a bit of a vestibular dysfunction. Why that was happening, we still don't know. It's very common to happen with concussions and head injuries, but she didn't have a history of head injuries or any concussions, and so it was still a mystery why this was happening. So the management strategy that I took after evaluating her was really a functional medicine nutrition approach. I wanted to work on improving her blood circulation and perfusion, as well as supporting her blood pressure, because we needed to improve that blood flow into the brain. We need to support her adrenal glands, because the adrenal glands help regulate salt retention or salt excretion. The more salt we have in our system, the more electrolytes we hold on to, and our blood pressure can go up. We wanted to support her blood sugar stability, right? Dysglycemia is this term of unstable, constant ups and downs, constant highs and lows of blood sugar, that is very inflammatory to the brain and also contributes to fatigue quite a bit. And we wanted to avoid inflammatory food triggers, right? So we were already eating a paleo diet. What I did was I wanted her to then cut out coffee and caffeine, as well as decrease her rice intake even further. She was already minimizing her rice intake, but I wanted her to cut it down even further and focus on increasing her protein and healthy fat intake. And of course, we did a pretty comprehensive blood test on her as well, just to make sure just to see if there were any signs of infection, or maybe an anemia or signs of inflammation, right? So I ordered a blood test for her just to screen for those basic things, just to make sure I wasn't missing anything obvious. And this is a little diagram here of the adrenal glands and the brain's relationship to the adrenal glands. Supporting the adrenal glands with issues of low blood pressure, dizziness, and orthostatic intolerance is very important, because the adrenal glands, here you can see pictured cortisol being secreted from the adrenal glands, but the adrenal glands release all kinds of different hormones, and one of them being aldosterone. And aldosterone is a hormone that signals to the kidneys to either retain more salt or to excrete more salt in the urine. And so we wanted to support this relationship between the brain, hypothalamus, out to the adrenal gland, and to support a healthy communication between this axis to make sure we were getting proper regulation of salt and proper regulation of blood pressure. And there you can see the adrenal gland in yellow, which is this little organ system that sits over the kidneys. And this is another diagram showing basically the same thing. This diagram is focusing on the stress and stress's influence on the hypothalamus, pituitary, adrenal axes. But you can see here how stress influences the brain, hypothalamus communicating to the adrenal glands, the adrenal glands secreting cortisol as well as other hormones to help manage blood glucose, sodium retention, potassium excretion, and prolonged stress and prolonged secretion of cortisol also suppresses the immune system. And our rehabilitation strategy, in combination with our nutritional changes that we were implementing, was trying to activate the autonomic nervous system, specifically the parasympathetic nervous system. And we were also, you can see in this video here, working at retraining her brain's perception of where she is in space. Using this isn't exactly a tilt table, it's actually a decompression table that we have in our office, but it basically has a motor that tilts the person up slowly and down slowly. And so we were slowly, starting from perfectly flat on her back, we were slowly increasing the degrees of angle as she comes up, and tracking her oxygen and her pulse rate average, checking for spikes in her pulse rate. And whenever, as we bring her up, when we see a spike, we bring her back down, let the system normalize out, and then we bring her back up again. And so we spent probably about 45 minutes to an hour slowly tilting her up, then back down, and then back up, and then back down, right? And this is one way you can reintegrate or recalibrate the vestibular system with body awareness and the brain's regulation of autonomics and blood perfusion. And at home, luckily I had a lot of this equipment at home. We bought a makeshift decompression inversion table, and we were able to do the same thing at home more often to continue her rehabilitation. Now, the results of what we did was pretty dramatic. We had almost 100% resolution of all symptoms in about 2 weeks. She was feeling great. All her fatigue was gone. She was back to exercising at full intensity, doing CrossFit with no issues. And then something happened. And I remember this vividly because on the weekend of my birthday, we got together with the family. We went out for breakfast for my birthday. And the restaurant, because it was my birthday, the restaurant brought us some donut holes, some deep fried inflammatory goodness. And my wife, she'd been feeling so good for 2 weeks, she took a bite of one of these donuts, and within 5 minutes, her health started to spiral out of control again. All her symptoms came back with a vengeance, and lasted 4 months. And I'm going to get into, in the next video, part 2 of this case study, what happened, right? So I'll give you a little sneak peek. Her symptoms got so bad and progressed to new ones that I said, okay, we need to take you through the medical system to make sure I'm not missing anything, right? I wanted to make sure there wasn't something more serious I had missed. And so we started our journey through the medical system, the primary care, who referred us to another, who referred us to another, who referred us to another specialist. We saw 8 medical professionals for the same issue. And it was just misdiagnosis after misdiagnosis with no support, no answers, nothing. And I'll describe in more detail in part 2 of this video what our experience was like. We ended up getting a full vestibular evaluation through a VNG study. We had to fight to get that. We had a neurooptometry evaluation done, and I'll explain more about that. But they're great at working with these similar set of symptoms, specifically after a head injury or a concussion or some sort of brain injury. And I'll talk about the additional brain rehabilitation strategies we implemented to try to get control of her symptoms and get her back to health. Right. So again, thank you for watching part 1 of this case study. In part 2, we'll finish up. We'll talk about what my wife's status is now with her symptoms, the struggles we had navigating the medical system, and all the 8 specialists that she saw, which really only 2 of them were actually somewhat helpful of the 8. So it was a very frustrating time, but we'll talk all about that in part 2. Part 2 will be released shortly, and you'll be able to see this one and part 2 on my YouTube channel. So go ahead and search my name there on YouTube, and you'll be able to find part 2 of this, plus some additional patient testimonials and case studies I've had in the past of other very difficult, debilitating cases that got really great results. All right. Thank you very much, and we'll see you in part 2.